As I said, I mean, often it's friends or relatives who comment about them. A lot of people, they recognise they're feeling sad. They won't say they're feeling depressed. They'll come in and say, I'm just feeling sad. One of the major presentations, fatigue. Fatigue is really common in anxiety, stress, depression. And they just know that they're not right. And often they'll come in and they'll have some physical symptoms as well. Because, when you're depressed, it can cause insomnia. You can sleep too much, you can sleep too little, you can be constipated, it can impact you in so many different ways. When you're stressed, depressed, you tend to get more illness, you tend to get more viral infections. So they often recognize that something isn't right about them. And a lot of the time they've tried alternative methods. They've taken vitamins. A lot of them have been to naturopaths. You could be not the first port of call. They could have done other things first. They come in so many different ways. If you think to times when you've been stressed, do you recognize when you're stressed?
Oh, God, yes, completely.
Your friends tell you, have you realized you're irritable, that you're not the bubbly person that you used to be? And friends will say, are you all right? And then it's sort of, well, no, I'm not all right. And then most people would realize it's becoming more high profile now. People talk about depression so much more. We all have days where you feel down. If anybody who hasn't had a down day is lying, because everybody occasionally has a down day where and you don't often, you can't put a finger on it. You just feel down for no particular reason. That's just the way it is. The people themselves rely on friends and relatives, to give them some hint that they may need to see somebody. Women tend to be more conducive to that. They're more receptive to hearing the message. I think men, it has to get more severe stage, but I'm generalizing here now, and I think it's changing. I do something called a DAS, which is a depression, anxiety, stress assessment. And it's just a questionnaire, and there's a short and there's a long DAS. When you get it, it tells you what level of anxiety, stress, and depression they have and how severe it is. Is it mild, moderate, severe, extreme? Are they in the normal range? So that gives you some sort of guideline as to how severe they are. As a doctor, what you've got to realize is there's a lot more that people can do for themselves is to encourage people to help themselves. That's the number primary thing to do. And two of the ways to help yourself is by learning to relax, learning to meditate. If people can learn to meditate, that is really, really tremendous thing to help manage stress, insomnia, anxiety, and so on and so forth. So just if you can get someone to do a meditation course or just to go online and to do the Headspace meditation program, that's really terrific. The second thing is exercise. Exercise by itself is just as effective as any form of psychological management and any form of medication. In terms of depression, exercise has a major improvement. By the time they get to the psychologist, their GP should have talked to them about exercise and meditation. And I'm going to refer them. I do a mental health plan and I refer them, often with a mental health plan to a specific psychologist. But the mental health plan doesn't mean they have to keep seeing the same psychologist. Now, I could recommend one, but when you're dealing with mental health problems, it's very important to have rapport. And if you refer them to a psychologist and they just don't get on, it's important that they have the flexibility. And the mental health plan means that they can see any psychologist. It doesn't fix them to one. What I'm doing is I do a lot of things that psychologists do because I use cognitive therapy now. First thing is you have to go into the history of the patient and you have to assess the patient, because a lot of people that suffer any psychological problem have got pre-existing issues. But some people haven't. Some people, the world around them collapses and it's stressful and it causes anxiety and they've got mortgage payments to make and they get more and more anxious. But these are, well-balanced people that have never had any issues. But then you've got other people and you talk to them and you can see that, these people have had ongoing psychological issues, that go back a lot of years. And, this is just another event for them and they've had, or they've got predispositions. So one of the things is to take a history, and obviously family history is important, because if there's a family history of depression, anxiety, it's quite likely that, through parenting and the environment they had, they could have what we call a lot of baggage and they could have issues in terms of faulty thinking. When we talk about cognitive behavioral therapy, we talk about faulty thinking styles, black and white thinking, catastrophic thinking, people who always, don't see all the positives in their life, they only see negatives, the ones who are always blaming themselves or the blaming other people. And so there's there's a whole list of different faulty thinking styles that people can come up with, mind reading, when they, he doesn't like me. Well, how do you know he doesn't like me? Well, I can just tell, it's, so all that comes into the equation, whether have they got pre-existing issues. The other thing is, when people come to see you is if they're very severe, I often look at medication. I'm not a person who's very keen on medication, but for example, I had a businessman, this is going back a few years, so this is pre-COVID, and his business had sort of gone belly up through no fault of his own. He'd been conned and someone had taken advantage of him, and he'd suffered a terrific loss, which meant that he probably would have to sell his house to pay off his debts. I haven't consulted him for some time, but I actually bumped into him the other day coming out of the surgery. He ended up on 2 different medications to get him through. So I think, medications is important. And short term, sometimes from insomnia, anxiety, you may prescribe something like a Valium, something that's anxiolytic. So this is something that the doctors would do. And often the psychologist may refer people back and suggest that. So if you send someone to a psychologist and they think that they really need to have some help, they would refer them back to you to prescribe some medication. I mean, any antidepressant takes about 10 days to work. And then the first one might not work, and then you have to put them on another one. And it could be the third one. So it could be a month before you start to get some treatment that's working. And even though you refer them to a psychologist and you're doing some counseling, there always is that vulnerable period. And some people seem to go from being reasonably good, they're functioning quite well, to being suicidal. I mean, this patient I'm treating just at the moment he's had 2 suicide attempts this year. The last one was at Easter. After the first one, he had a stint through the Veterans Affairs. They had him in hospital, for about 10 days. If you suspect someone is at that level, it's hospitalization for their own safety. This would be a primary consideration. The trouble is, a lot of the time, these people don't have insurance, and the public system isn't that easy to get in. I mean, you can refer them to the outpatients and for assessment, and they may keep them there for a day or 2, but usually they rebound very quickly. If they've got private insurance, then they're more likely to be there for a week or 2 weeks in a private institute, and then that means that they're placed on medication, it's working, they see that they're improving, they've had the initial counselling, they've had fairly active psychological management. I think for most people, they can work through these situations. They can change. And I think one of the things about timeline therapy is telling people that you can change and you can be in control of the changes that you want to make. The positive thinking, the rehearsal, the mental rehearsal, within, the bounds of reality where you want to go, you can go. And I've seen one young girl, she would have been 17 or 18 and you couldn't get a word out of her. And after she went through mental rehearsal, and you couldn't stop her talking. She was like a chatterbox all the time. She became from the most introverted to extroverted. It was absolutely amazing. Worthwhile cause. Anything that draws attention to mental health and makes people realize that everybody's got a responsibility to be aware of everybody else. We can't just put our heads in the sand and ignore other people. If we think that they are under pressure, we've got to do something about it. Even a question, are you all right? Are you okay? Is there anything I can do? What it takes. And if you put it in a question format, it's not threatening. If you go to them and say, I think you're depressed, well, that doesn't go down well. Can I help you? Is there anything I can do? You don't seem your normal self. And I'm all right. And you just, in a very roundabout way, you just approach it.